Hi, Chris Ohl, Wake Forest School of Medicine, Infectious Diseases, with a brief COVID update coming to you in a recorded sense today. So our cases and case counts here in the Triad, as well down in Mecklenburg County in the greater Charlotte area, looks like that they've peaked. A little bit of variances from place to place, but our current wavelet seems to be peaking. Looking at our sewage numbers as well as our case count numbers. Hospitalizations in our area remain low, and they really haven't changed the number for the last 3 to 4 weeks, and are definitely in a comfortable range. Most of the people in our hospitals are still unvaccinated, or persons who have been vaccinated but are at the extremes of age, particularly those over the age of 75. So the pandemic's not over, but we've kind of reached a spot, I think, where we're coexisting with it to some extent. I think a lot of people are getting out and doing activities that they would otherwise want to do, go on vacation and or have some social events, get together with family, travel. Boy, domestic travel's way up, and even some international travel has increased. But one should still think about what you can do to keep from getting sick, particularly if you have underlying health conditions, or if you're older, or if you're immunocompromised. For getting sick with COVID could still be serious business. Most people who have had vaccination and their quote third shot or booster, I like to call it completing the 3-shot series, usually when they get COVID, get a breakthrough infection, which is a cold or a flu-like signs and symptoms that last about 3 to 5 days. Rarely is it serious, and long COVID in this scenario is likely somewhere between 1% and 4% or less. But no one likes being sick, and so if you're in areas where exposure might happen, such as at a birthday party, wear a mask. If you're going on transit, you can wear a mask. Getting together in an indoor social situation, wear a mask. In fact, if you look at the CDC's color criteria for our area, we would be in red, where masking is definitely recommended when indoors. Now, one has to take our color code for Forsyth County a little bit in stride, because we have a lot of acute care hospital beds in Forsyth County compared to the level of our population. And one of the metrics the CDC uses to make its color code is taking the number of hospitalizations and dividing it by the number of the people in the county. We have almost as many hospital beds in Forsyth County that Charlotte has, but Charlotte's population is a lot higher, less they're in yellow and we're in red. So I think the way it feels and the way our other numbers look, I think we're more a yellow than a red for Forsyth County. We've been asked about mask mandates. Will mask mandates be coming back? So let me start out by saying masks work. If the population at large wears their masks, such as during a mask mandate, transmission clearly goes down. And it goes down for the community at large. It goes down for the region at large. It also goes down for any particular setting of people. So a school that all of a sudden everyone started wearing their masks again, their transmission numbers would go down, a workplace, so on and so forth. So, but the thing is you kind of have to be all in. So if you're wearing your mask at work, and then you come home and you don't wear a mask in social situations or during traveling, then your exposure risk goes up, and it kind of cancels out what you're doing at work. So it should be an all-in thing. I think the appetite for mask mandates is not real high right now, and I understand why. So I think what we need to do is keep our masks in our back pocket, from a community sense. And if we need it, again, we can bring it back. I don't think the current wavelet height is high enough. I don't think that the severity of the Omicron subvariant infections in most people is high enough to warrant mask mandates at this time. But if either of those parameters should change, then we'll be talking with our government authorities about potentially do it. And I haven't spoken with the mayor right now, but I happen to know that he isn't planning on instituting mask mandates for Winston-Salem right now. And I agree with that. But that doesn't mean as an individual, you can't make your own decisions and choices. As I keep saying, no one wants to be sick anyway. So graduation, high school graduation come up. I think most people have been thinking about that a little bit, particularly high school seniors, very excitedly. Graduation itself is usually in large venue areas, such as the Joel Coliseum or the Annex. Transmission of COVID is a little bit less in these settings than in other indoor areas, but it wouldn't surprise me if there isn't some COVID transmission associated with graduation. Again, you can lower your risk by just wearing a mask during the graduation ceremony. Probably more problematic are the parties that happen associated with graduation, either afterwards or on the weekend. Those are best done outside. I think most high school kids would rather be outside anyway, rather than hanging out indoors when the weather is so beautiful. Outside, transmission's really hardly a factor at all, unless you're in a really crowded or bunched up situation. And again, if that should occur, even if outside, wear a mask for these events. A little bit of good news on the horizon regarding vaccines. Over 70% of people now in North Carolina, including here in Forsyth County, have had at least 2 shots of vaccine, messenger RNA or 1 J&J vaccine. And roughly about 63% Forsyth County have had a booster shot or the 3rd shot in their 3-shot series. I would like that to be higher. Most of us would. There's still a lot of opportunities. I think one thing that's keeping people from getting their 3rd shot is, or 4th shot for the elderly or people with underlying health conditions, is that they feel that the pandemic is pretty much over. Well, that's definitely not true. Also, particularly for the people who are over the age of 50 or so, who are eligible for a 4th shot of the series, they're wondering if it may be better to wait until this fall to get boosted. And I think that, you know, if you're under the age of 65 and otherwise pretty healthy, I think it's okay to wait for this fall to wait and get a booster, particularly if you've had COVID since the Christmas time frame, roughly, because that's basically the same as getting a shot. But I definitely would put it on your calendar for getting it this fall. The other thing that's going on in the vaccine world is next week, our under 5-year-olds will get an FDA approval for COVID vaccine. 2 will be out there, Moderna and Pfizer. Moderna will be a 2-shot series, Pfizer a 3-shot series. Probably not a lot of difference between the 2. Both of them have been shown an excellent safety profile in that age group. And both of them are immunogenic, including against the Omicron variant. Moderna may be just a tad bit more than Pfizer's. And the amount of vaccine material in that vaccine is a little bit higher than in Pfizer's. Thus, they can do 2 shots. If you have children, particularly children who are in daycare and or getting ready to go to school this fall, I'd get them vaccinated. Yes, it's unusual for kids to get severe COVID. It does happen, about 1 in 500. But when it does happen, it can be serious, and vaccination will prevent that. The other thing is it helps prevent disruptions in your life. So if you're thinking of going on vacation, it's less likely that your family will be exposed through one of your children if the kids are vaccinated. That also goes for the 5 to 12-year-olds. We'll be getting boosters lined up for 5 to 12-year-olds here in the near future, including at the health department. And they're That is something that I would definitely consider as a parent, because those kids got Pfizer's vaccine last November. It turns out that 2 shots of Pfizer's vaccine at that particular dosage given last November is not all that immunogenic for the Omicron variant, and thus the level of protection is lower. It's pretty good still for severe COVID, but breakthrough infections tend to occur pretty easily in that age group. It should have been a 3-shot series all the time, and thus this is the opportunity to get the 3rd shot for that messenger RNA in what should have been a 3-shot series. I think it'll help you get through summer, and particularly if you have a child going to a sleepaway camp or having a lot of activities, social activities this summer, which kids like to do in the summertime. I would go ahead and get the 3rd shot now, and it won't prevent them from getting boosted again in November. So I think that's all I have to say about vaccine, except, one more thing. Novavax's vaccine is likely to get approved here fairly shortly. That vaccine's a little bit different. It's not a messenger RNA vaccine. It's a protein recombinant vaccine, which is like how we make a lot of our flu shots and hepatitis B shots. It's the same way, same technology. It isn't newer like the messenger RNA. In fact, we've been doing that for those vaccines for roughly 30 years for hepatitis B. So some people who may have been a little hesitant because of messenger RNA being newer should and could be open to getting Novavax's vaccine. Production of that vaccine takes a little bit longer. It's a little bit harder for the company to do. Supplies may be a little bit more limited at first, but I'd expect to see that available in the first part of July. And for those people, small number of people who got kind of allergic problems from the messenger RNA vaccine and thus didn't get a booster afterwards, can get this vaccine, and the allergy aspects shouldn't really apply to it. So with that, I think I'll go ahead and wrap it up. We'll come back in 2 weeks. I'm going to do a little COVID update in 2 weeks, but I'm also going to focus on staying healthy during the summer when you're at the lake or at the beach or out hiking, how to keep the insects and the buggies off, and we'll talk about that then. So signing off until 2 weeks from now. Chris Ohl, Wake Forest School of Medicine, Infectious Diseases.